Good day, everyone. Welcome to CSA Certified Skin Authority. I'm your host, Doc Tessa, giving you highlights on the science of skincare, aesthetic dermatology, anti-aging medicine, and laser technology. In today's episode, let's talk about skin discolorations, blemishes, melasma, and birthmarks. What's the latest technique nowadays to treat all these skin concerns? Please don't go away and watch CSA Certified Skin Authority.
Hi, I have a concern regarding birthmarks or pigmented birthmarks. My ultimate dream is to become flight attendant. Nag-enroll ako sa isang flight school. So one of the requirements is you shouldn't have any visible marks like tattoos or birthmarks. Tinanong nila ako if willing ako to do the laser treatment and I said yes. So I heard about CSA Derm Center regarding the laser treatment.
Welcome back mga kapitbahay! Atin pong pinag-uusapan ang patungkol sa mga hyperpigmented marks or birthmarks. Makakasama po natin ang isang certified nurse, none other than Miss Cheng Pairez.
Hi! Magandang araw mga kapitbahay. So, thank you again for having me as your guest
Of course,
for today.
she has been a regular co-host here at Certified Skin Authority.
Yes.
So Cheng, napaka-common nitong mga blemishes, skin discolorations, melasma, di ba yung parang mapa dito sa both
Opo.
cheeks, or yung mga pigmented marks,
Yes, Doc.
birthmarks. So, do you have any ideas about this?
Actually, wala to. Pero syempre, with regards to beauty, di ba? You don't want to look may something sa mukha mo na.
Correct.
Tsaka yung self-esteem mo, di ba, nakaka-affect.
Low self-esteem, yung confidence,
Confidence ka yung
mahina.
face mo, di ba? Pag you
Oo.
flaunt and you
Exactly.
walk.
Psychosocially, parang
Yes.
hiyang-hiya silang humarap sa mga ibang
Opo.
tao. Like yung isa nating guest kanina, ang concern niya
Mhm.
sa elbow area, meron siyang birthmark, very pigmented, darkly pigmented.
Yes.
And she came to CSA Derm Center asking for a solution to that concern. I think she's applying for a flight attendant position.
Oh, wow! Pero very, sila meticulous regarding
Yes.
sa mga people nila. Kasi, syempre, they front kailangan beautiful.
Ang mga flight
face,
attendants yata, bawal silang may mga scars, blemishes,
Scars.
peklat, di
Opo.
ba?
Even
Okay.
sa meat and something. Very,
Yeah.
very meticulous. Very, sila.
Ikaw yata kinukuhang flight attendant, Cheng, ha? Tinanggap mo na ba? Hindi pa.
Nurse.
Nurse.
At heart.
Okay. So since we're talking about pigmentary
Yes,
skin
Doc.
concerns,
Mhm.
the common ones that we see, melasma
Opo.
or brown patches on both the cheeks, minsan naman sa may forehead area, minsan naman nasal, nose area, minsan naman upper lip, lower lip, minsan sa chin. So makikita mo yan, pupunta sa clinic,
Opo.
napaka-darkly pigmented.
Mhm.
So melasma is brown patches. Or other term, yung parang mask of pregnancy.
Oh, yes.
Diba yung mga
Naalala ko po
women,
yun.
yes, yung mga babae pagkabuntis, nagkakaroon ng mga discolorations,
Discoloration sa face
diba?
po.
Darkly pigmented here on both cheeks. Yung iba naman sa neck, yung iba naman sa armpit, groin area, etc. Diba? So, actually yon ang mga causes, isa doon, hormonal.
Hormones.
Yes,
Over
kasi like, exactly, pregnancy hormones, diba? Meron din daw stress hormones.
Oh, yes.
What do you call this? Trigger or stimulate ng pagdami ng mga pekas or blemishes.
So, Ang dami talagang factor na stress.
Exactly. Ang explanation nila doon was
Oo.
that yung daw stress hormones can trigger yung tinatawag na melanocyte-stimulating hormone.
Oh.
Di ba mga melanocytes?
Opo.
These
Sa
are
melanin.
cells that make melanin or brown pigment.
Yes.
So nagkakaroon ng overproduction ng brown pigment dun sa skin area. Okay? And ang melasma or yung mga pigmentary conditions na ganito, may classification.
Okay.
Meron tatlo.
Opo.
Yung isa, superficial. Yun yung epidermal sa ibabaw.
Yung mga,
Yes.
dito pa lang siya parang
Yes.
part pa rin.
And then yung pangalawa, yung dermal or deep.
It's like the second.
Nandoon sa inner
Second
layer.
layer. Second
Exactly. And third, combination.
Combination.
So I see some women,
Opo.
even men,
Mhm.
meron silang patches, brown patches on their face. So may nakikita ka, may area na light or superficial, may areas that are deep or very pigmented or darkly pigmented.
Okay.
Okay. So, those are examples ng mga pigmentary conditions. Melasma pa lang yun. Diba? Meron pa nga yung iba freckles.
Yes.
Common
Yeah.
ng freckles, di ba, sa mga Caucasians,
Yes. Pisay.
white skin.
Pisay.
Lindsay Lohan, di ba?
Mga
May
ganyan.
freckles din. So, another pigmentary condition.
Mm.
Tapos, yung common din, yung mga sunspots or
Oh.
solar lentigos,
Mhm.
yun yung from the sun rays.
Oh, yung
Diba?
mga na-overexposure sa sun
Exactly.
everyday.
Oo. Meron nga yung case of overuse nung isang over-the-counter na solution, ina-apply all over the face,
Mm-mm.
and then exposed siya sa init ng araw, and then nag-create ng mga,
Spots.
yes, blemishes, brown patches, induced by some solution, mga over-the-counter doon.
Yes.
And then nagpapaaraw. So, una, namumula-mula.
Mm-mm.
Tapos after a while, nangingitim na.
Oh my gosh. Yun yung problema pag mga on the counter.
Yes.
Na mga
Yun din
lang.
yung mga post-inflammatory hyperpigmentation. So, yun. Meron naman yung nai-inherit. But these are, may medical terms na to. Like,
Genetics.
for example, horis nevus. Or nevus is the medical term for mole.
Oh, okay.
Mole, yung mga pigmented moles. Yung mga melanocytic moles. Okay? Yun, mga pigmentation din yung
Opo,
mga yun.
tsaka meron din cases na talagang sobrang dami din ng mga moles na
Yes. Okay, ano pa bang naiisip ko? Age spots.
Yes.
Aging. Okay. So sa
Next
aging,
part, but you can
yun.
control, right?
Huwag kang mag-age. So meron yung mga people na napapansin nila as time passes by, habang nagkakaedad, nagkakaroon ng mga brown spots. Okay, mga age spots, sunspots.
Opo.
Okay.
Parang, dati wala akong ganito. Ano naman to? Ano to?
Exactly.
As you
So,
grow old.
those are the hyperpigmentations. Now, yung isang client natin, ito naman, birthmark.
Birthmark.
Same ito dun sa mga nevus of Ota, horis nevus, yon. Very deep yung pigmentation niya.
Meron din po ng classification din po with regards
Yes.
to
So,
birthmarks.
depending on the classification, then yung treatment will follow. Kasi there are treatments that will only target the superficial layer,
Okay.
the upper layer, and there are treatments that will target the inner or deeper layer.
Wow, Doc.
Okay?
Parang nakaka-excite naman malaman yung treatment na
Yes.
yan.
And right now here at CSA,
Oh,
we
yeah.
would want to highlight what is that treatment that can target yung mga deeper
Yes.
melasma, deeper pigmentations, or dark pigmentation.
Yan yung mga hindi na nakakaya ng mga topical,
Like chemical
so, kailangan
peel,
talaga ng treatment.
diamond peel, yeah, hindi na yan kaya nitong mga superficial treatments.
Well, I think that's good news.
Yeah, that's really a good news. And actually, we're referring to pigment laser.
Oh, yeah.
It's a laser technology
What about it, Doc?
made right now kasi
Wow.
it emits some kind of, yun nga, mga laser energies na nakaka-penetrate into the inner, into the deeper layer. Yes. So it will disperse or dismantle some of the pigments there, some of the melanins there.
Okay.
So we'll actually be showing the actual procedure of this pigment
Yes.
laser on our client who was featured a while ago.
Okay mga kapitbahay, sa ating pong pagbabalik, pagpapatuloy po natin pag-uusapan ang further information regarding other skin pigmentation problems. So folks, don't change that channel because CSA will be right back. Okay mga kapitbahay, so we are back once again with my one and only Dr. Tessa. Okay.
Welcome back mga kapitbahay. So ating pinag-uusapan pa rin ang patungkol sa mga hyperpigmentation sa ating skin. Okay. A while ago, we have mentioned about melasma.
Yes, melasma,
freckles, birthmarks, sunspots, age spots. Meron pa tayong pwedeng idagdag dyan, Cheng?
Yes, Doc, what it is?
Okay. You've heard a while ago yung tinatawag na post-inflammatory hyperpigmentation.
What about
it, yung, yes, example dyan yung mga acne marks or acne blemishes.
Yes.
Diba, after the acne has healed, after the inflammation has gone away, meron siyang iniiwan na pigmentation also. Okay, yan isang example. Another one, yung mga after nung mga eczema or after nung mga irritant dermatitis, when they heal, kasi initially they're so red.
Opo, tapos yun yung
erythematous. And then after that, nag-iiwan sila ng dark color, dark pigments, di ba? So yun, under the category of post-inflammatory hyperpigmentation.
Oh, so yan pala ang ating term. Nice to know, nice to know.
So, example pa yun ng mga pigmentary conditions. Then we've also mentioned, di ba, yung mga moles, nevus,
Opo.
di ba? Kasi a while ago, sabi mo nga sa akin, yung mga moles ba, kasali ba dyan?
Yes, under pa siya sa category.
Oo. So, yung mga, meron kasing mga hypopigmented na mole, yung parang hindi sila pigmented, but they are moles. No? Meron naman yung pigmented na mga moles. Nunal.
Opo.
Yan. So, okay. Yung case natin kanina, the one we featured, yung sa elbow area niya, di ba yun, that's a pigmented birthmark. Okay. But then actually, when she consulted me nga pala, she mentioned that she had a tattoo.
Tattoo, okay.
Nagpa-tattoo siya dun sa may birthmark area for the reason or purpose na parang takpan, conceal, yung mismong birthmark. The birthmark was just a little bit, what do you call this? Compared sa normal skin color niya, hindi naman siya ganun talaga ka-dark na pigmented. Parang tan, mas tan ng konti kaysa dun sa skin niya. Pero when they did the tattoo, so syempre, di ba, it's, what do you call this? May mga needles pag nagta-tattoo. And so, may redness after that.
Inflammation and all.
Exactly, inflammation. So, pwede rin magka-post-inflammatory hyperpigmentation. So, yung nangyari dun sa case natin na yun, nagkaroon ng PIH also.
Wow, yun lang.
So, with that, yung tattoo also concerned din ng mga clients natin. Ano ba yung pwedeng solusyon din dun sa tattoo? Kung gusto kong matanggal, mawawala ba talaga siya? As in, babalik ba yung skin ko dun sa normal color?
Before.
Oo, kung ano yung dati niyang appearance, right? So, kasi may mga individuals that would wanna get rid na dun sa mga tattoo nila. There are individuals who wanna get rid of the birthmarks. There are people who wanted to remove the moles. Especially yung mga mole dito sa nasal area. I've heard yung, lalo na yung dito daw, daanan ng luha. Narinig ko yan.
Sabi nila.
Yes. Tapos, ano pa ba yung mga pigmentations na gusto nilang patanggal? Yun nga, yung minsan yung mga round blemishes or circular spots on the cheek area, buti na lang may solusyon na dito sa mga concerns, itong mga skin dilemma na to sa pigmentation, di ba? Diyan yung tinatawag nilang yung mga pigment lasers.
Pigment lasers.
Okay.
So, may different types din po, no? For different cases din.
Kasi merong CO2 fractional laser, meron yung alexandrite laser, ruby lasers, etc.
Wow.
Pero yung sa pigment laser will give emphasis dun sa specific laser na tinatawag na ND-YAG laser.
Okay, ND-YAG laser.
ND-YAG.
Yes.
Well, yung NDIAG, yung N stands for neodymium.
Oh my gosh.
Neodymium. Tapos yung Y is yttrium, then aluminum garnet. Yun. So,
Wow.
napaka-chemical name naman.
Wow,
Yan.
doktora.
Yung mga lasers, they emit some kind of light pulses. Okay?
And then,
They can target or penetrate the deeper layer.
layer of the skin.
Okay? Of course, kung pwede siya dun sa inner layer or dun sa deeper layer, pwede na rin naman siya dun sa upper or sa superficial
Yes.
layer. So, yung machine, we can actually have a modification dun sa
Adjust. Kung halimbawa, kung
energy.
gusto mo mas malalim.
Yes, dun
tapos,
sa depth na
Wow.
you wanted to target.
Wow,
Okay?
that's good.
So, we are now hearing about this NDIAG pigment laser. So, ang indication talaga nito are yung mga pigmentary skin conditions. Yan, melasma, freckles, pigmented birthmarks, pwede sa mga moles,
Wow, wow.
post-inflammatory
So,
pigmentations. Although, by the way nga pala, ang mga post-inflammatory pigmentation, naturally, they also fade away.
Fade away. But
Kaya lang
it
matagal.
takes time, like
Yes.
years.
Oo.
And we don't want that to
actually,
happen.
Months, pwede rin mong sabihin na several months. May ibang cases, 6 months. Meron nga, 4 months. So, pwede
Case-to-case
rin mag-face.
basis.
Yes.
Kaso paano
Yung
kung
mga
tao?
acne blemishes, there are other individual, mabilis lang mag-clear.
Clear
Yung
up.
mga pimple marks na yon. So, those are the PIH. So, aside from that, so sabi natin, moles, freckles, solar lentigens,
Birthmarks and all.
yun, birthmarks, sunspots,
Yes.
age spots, okay, lahat ng mga pigmentary conditions, darkly pigmented birthmarks, will be targeted by this
Wow.
NDIAG laser
Wow,
or
that's
pigment
so good.
laser. Okay.
Wow, answer prayers po ito sa ating mga
Meron
ibang
nga palang
mga kapitbahay.
Meron palang nagtanong, masakit ba?
Oh yes, yun nga po,
Is
yun
it
lang.
painful?
Yan.
No? Kasi ang sensation ng mga naka-experience na ng NDIAG laser, it's like yung parang parang pitik sa skin or
Pitik.
parang yung slight of a rubber band snap. Parang snap,
Kayang-kaya
snap lang.
naman pala
Yeah,
yan. Tolerable.
Well tolerated. Mas masakit pa yata matattoo. Kasi yung mga iba,
Ah.
their problem is how to remove their tattoos. Kasi some people, di ba, ayaw na nila yung
Oo, parang nasawa
tattoo.
na.
Oo, meron yung parang naghiwalay na sila ng kanyang
Yung mga
boyfriend or
nagpapalit ng
girlfriend.
pangalan na.
Dati nilagay niya yung pangalan,
Yes.
BF or ni GF. Gusto na nilang mawala. So, anong solusyon?
Gusto ko mag-move on.
Diba? Ito na po. Meron na yung pigment or NDIAG
Wow.
laser for
Wow.
that. So, mas masakit pa nga yung tattoo kaysa dun sa experience ng laser na ito. Actually, there's no need for topical anesthesia for this one.
Wow.
Kung natotolerate mo yung
Yung
parang
pain.
parang snap sa skin and no need for the topical cream.
Oo.
So, the procedure, actually, it will take quite a short period of time. Depende dun
Depende
sa laki
Laki.
nung kanyang pigmentation, di ba? May iba kasi parang tiny spot lang eh. May iba tiny dots lang. So, few minutes lang yon,
And yung
mabilis lang.
doon din po nagba-vary yung sessions din po.
Yes. Tapos, ano pa bang mga tanong tungkol dun sa Q-switch NDIAG laser? May additional pa siya, may Q-switch NDIAG laser pa
Wow.
siya. Aside from being painful, tinanong nila, will my skin go back to its normal color?
Yes.
Its natural looking appearance?
Yes, from what it was before, mga
Yeah.
ganon.
Well, actually, ang NDIAG laser can bring back yung usual color. Kung for example, it's from
Wow.
yung mga, like for example, yung sa tattoo.
Opo.
No? But then there's a very deep pigmentations naman, okay? Definitely the superficial ones na the target na yan. Yung mga very deep, you need several sessions.
Sessions, yun na.
Yeah. Well, dun sa last naming conference on the pigment lasers, they were saying like, for example, yung mga deep melasma, you may need like a minimum of 10 sessions.
10 sessions.
So, for every condition, nagba-vary kung ilang
Yes.
sessions ang kailangan. Okay? But actually, before we do the procedure, we assess muna yung aming
Yes,
clients.
pinaka
Yes.
number one, SOP dapat
Of
assess.
course, we do physical assessment, medical history, check natin yung skin condition, check natin hydration ng skin, and phototype ng skin. So, it is very important to consult muna your skincare
Of
specialist
course.
before going into this
Yes.
pigment laser po. So, ano pang tanong? Wala na?
I think we're all good. I'm excited to check this out.
Correct. Okay, correct. So, for our client, we wanted to see the effect on this
Yes.
one. And mga kapitbahay, atin pong abangan ang procedure ng pigment laser. Ito pong procedure na ito actually ay madali lamang. And of course, ang ating mga clients, before natin po silang i-laser, gumagawa muna po kami ng assessment sa kanila. We have to check ano pong klaseng pigment lesion ang meron sa kanilang skin. And then, pag atin na pong na-identify kung ano pong klase itong pigmentation, okay, and ito po ba ay superficial or epidermal, or ito po ba ay deep or dermal pigmentation. Then, alam po natin kung anong klase ng laser energy ang ating pong gagamitin. Bago po namin gagawin ang laser procedure na ito, atin pong nilalagyan ng pampamanhid ang balat ng ating pasyente. Ito po yung topical anesthesia. Iiwan po natin ito ng mga ilang minuto lamang, pwede pong mga 30 minutes. And after that, we may start with the procedure. Kung pong ang treatment area ay maliit lamang or ang pigmentation ay superficial lamang, maaari naman pong walang anesthetic cream dahil very tolerable ang treatment. Ang description ng ating pasyente kung ano po ang nararamdaman during the laser is like parang snap ng rubber band, or ang ibang pasyente naman parang wala lang, or parang prickly heat, or parang tingling sensation. So, ito po yung napaka-safe na treatment, napaka-effective, proven po ito, well-studied po ito, and ang ginagawa po ng laser machine is to break down yung mga pigment molecules in the skin. So, pag broken down na or disintegrated na po yung pigmentation, nakikita po ang pag-lighten ng skin problem, yung mismong pigmentation or pigmentary disorder sa skin. So, ang ating pong ginagawa ngayon sa ating mga pasyente, yung una po, yung problem sa birthmark. Very pigmented birthmark on the elbow area. So, we just flash some of the lasers. There are certain frequencies. Meron pong mga specific indications or specific calibrations dun sa ating laser machine or specific wavelength at kung anong depth ang ita-target ng ating laser machine. And meron din tayong pasyente na ang concern ay yung mga sunspots on both cheeks of the face. So ito, medyo superficial lang yung sa kanya. So we can make use of some superficial depth din na laser energy. So we just flash some of the laser frequencies on both cheeks of the patient. We also have another one na ang concern is melasma on both cheeks. So, ganun din po, atin din pong ipa-flash yung mga specific laser energy on the specific areas. Actually po, we can also do the whole face of the patient. Kasi in addition to targeting the pigmented lesions, it can also give skin rejuvenation, and yung may mga concerns of scars or even yung may mga concern of large pores, they can also be targeted with this kind of treatment. So the procedure may last for a few minutes to like half an hour. So it will depend kung ano yung area na ita-target natin. Kung wider area or just a small area only. So usually you have to spend like about half an hour in the clinic. And of course, we really give time to explain to our patients what are the indications, what are any precautions. With this kind of laser treatment, wala naman po masyadong bawal. You can actually do it during your break time from your work or during your, like for example, after your work, you can also do this. Well, ang special precautions lang po namin will be to avoid sun exposure. Okay? And then after the treatment, we can actually advise the patient to apply some topical creams like yung mga hydrocortisones to soothe any erythema or redness or any sensation of discomfort on the skin. Other than that, wala naman pong ibang ipapa-apply or gamot na iti-take. So the procedure is very easy, very simple, very tolerable. And after the treatment, you'll notice some breakage in the pigments already. Manonotice mo, may areas na naglalighten na ang pigment. So napaka-effective, napaka-safe, and our patients are very comfortable. Hindi naman po sila nagko-complain ng anumang stinging or any discomfort at all. So mga kapitbahay, nakikita nyo naman po while we are doing this, our clients, our patients are very well attended to, and the machine is so good, it's very effective. Well, I asked the patient kung meron ka bang nararamdaman, and they were saying it's nothing, it's fine, it's okay. So some people are asking, is it painful? Hindi naman po siya painful. Wala naman pong, actually yung 2 clients natin, hindi po kami nag-apply ng topical anesthetic cream. We only applied with the client na birthmark ang concern. So kung deeper ang pigmentation, we can apply some numbing cream on that area. Okay, so you can see yung 2 clients, okay, on their face, hindi po kami nag-apply ng numbing cream. So we can directly do the procedure, and actually it's very quick to do it. And then we actually advise them to come back, like for especially those what we call toning or initial treatments, they can come back like after 2 weeks for a follow-up. And so after 2 weeks when they get back, we assess on the pigmentation already. And then we will tell the client kung kailangan pa ng follow-up treatment, because we have some patients na initial pa lang naglalighten na ang pigmentation. So no need for another second session. But for some clients also who have deeper pigmentation, they may need several sessions. Okay? So this is so effective. Also with those concerns of tattoo. So kung meron kayo dyan na gusto nyo nang patanggal po yung mga tattoos ninyo, this is a very effective laser treatment we can do to remove or erase the tattoos. So, yung mga I know, meron pong iba dyan, gusto nang patanggal ang mga tattoos. So, ito rin yung same procedure that we do. So, actually, during the treatment, nakikita na ninyo na naglalighten na yung tattoo. So, especially yung mga dark pigments na ginamit, there's a blue dye or black dye, we can target that. Also, for those warmer pigments, like yung may mga red, orange color dyes, we can target with this kind of laser, the so-called ND-YAG pigment laser. Okay? So, napakaganda pong i-try nito for those with concerns also freckles, okay, melasma, okay, sa mga moles, sunspots, age spots, tattoos, birthmarks, or any other pigmentary concerns. Okay po. So, meron na tayong solusyon sa mga ganitong skin dilemmas. Okay, mga kapitbahay, I'm pretty sure that you're appreciating how well it is being done. And I'm pretty sure a lot of you are interested to try this one. So, well, if you're gonna ask about the pricing, well, it will depend on anong area, how wide, and how deep it will be. So, it's very important to seek consult muna sa aming clinic for you to know kung ano yung magiging costing. Okay, so yun po yung procedure, mabilis lang. It will take you like a few minutes to half an hour. And then, there's an assessment prior to the treatment. It's not painful, it's well tolerated. Wala pong masyadong mga contraindications. And of course, you can definitely say that this is a very good treatment for me, especially kung ang concern niyo are pigmented lesions on the skin. And if you want to rejuvenate your skin, you can also try this ND-YAG laser. Or if your problem will be scars or large pores, or you want to target yung mga pock scars, acne scars, you can also make use of ND-YAG laser. So actually, the machine that we are using right now is the so-called Lucid Q PTP. So Lucid Q for Q switch, and then PTP for photoacoustic twin pulse. This is a wonderful technology whereby they were able to minimize any side effects or any pain sensation, because they're making use of twin pulses. Dinivide po nila yung wavelengths ng laser energy, so wala pong nararamdaman na pain at all. So here at CSA Derm Center, we have this ND-YAG laser available for pigmentary skin conditions. So you may want to try this. Consult us for problems of melasma, especially those with deep melasma. I know you have been struggling with how you gonna stop this, how you gonna erase this or remove this. Now there is a solution for the deep melasma, the so-called pigment laser or ND-YAG laser. Sa mga kapitbahay, hopefully you have understood, and of course, you may want to try this. So don't hesitate to call us po sa aming 04533111117. We're more than willing to help you and answer all your questions.